Hi, my name's Nick, and I'm going to be your nurse today. Can you tell me your name?
I'm Emily.
And do we have your permission to videotape for this assessment?
Yeah.
Okay, I'm going to be doing a neurological assessment today. So I'm going to start with a couple questions for you. Have you had any frequent or severe headaches?
No.
Any lightheadedness or dizziness?
None.
Any difficulty swallowing or speaking?
No.
And any numbness or tingling?
Nope.
Okay, well then we're going to go ahead and start with the cranial nerves. The first one being assessing for smell. So I'm going to have you close your eyes, and I'm going to put a couple scents near your nose, and I just want you to tell me what you smell.
Apple.
Good. And I got one other one here.
Lavender.
Very good. Next, we're going to move to cranial nerves 3, 4, and 6 with extraocular movement. So I'm just going to have you keep your head straight and look forward at me, and only move your eyes following my finger. And the other side. Good. And no abnormal movement in the eyes, which is what we're looking for there. So next we're going to do an assessment of distal visual acuity and near visual acuity. So over here we have the Snellen chart hung up. And the one that I have printed off here is for 10 feet. I think we're about 10 feet from it. So go ahead and read for me the smallest line that you can read on the chart there.
LEFODPCT.
Good, and that's 20/20 vision. So vision for R is good. Then we have a Geiger chart here to test for reading. So if you can read the smallest one that you can read.
Able treaty the restitution of the standards and prisoners which have been taken in the defeat of Crassus. His generals in the early part of his reign attempted the reduction of Ethiopia and Arabia Felix. They marched near 1,000.
Good, and that was about 12 inches, which is what we want there. And you read the smallest one, so your near visual acuity is good. Then we'll move on to cranial nerve 5, which is facial sensation and muscles of mastication. So here I have what's going to be dull and sharp feelings. So go ahead and hold out your hand for me so you can feel the difference. That's dull and that's sharp. It's going to do a couple different spots on your face to test for sensation. So go ahead and close your eyes and tell me what you feel.
Dull. Sharp. Dull. Sharp. Dull.
Good. Then the muscles of mastication here. Go ahead and bite down. Good. And pull down. Yep, very good. Next we'll move to facial movements, which is cranial nerve 7. I'm going to have you make a couple faces for me just to make sure everything is symmetrical. Go ahead and smile and frown and pucker and puff out your cheeks. Good. Next, we're going to work with hearing for cranial nerve 8. We're going to do the whisper test. So I'm going to whisper a 2-syllable word, and you just repeat back to me. Baseball.
Baseball. Cupcake.
Good. Then we'll move to gag reflex and uvula midline position for cranial nerve 9 and 10. Normally we would want a tongue blade here, but we're going to use what we have. So go ahead and open up your mouth for me and stick out your tongue. Say ah.
Ah.
And uvula is midline. I'm going to test gag reflex. Good. Gag reflex is intact. And we'll move to cranial nerve 9, which is the sternomastoid and trapezius muscle strengths. Going to have you shrug your shoulders. Good. And head down. Good. side to side. Good. Good. And then we will move to cranial nerve 12, which is inspecting for tongue deviation or tremor. I'm going to have you stick your tongue out and down. Good. Up, down again, side, and other side. Good. No tremor, no deviation. Then we are going to inspect the different deep tendon reflexes. First, we'll work with the arms. So I'm going to have you hold your arms out to the sides for me. Test the tricep here. We are looking for the little dip behind the elbow. Good. And hold your arms out straight for me. We'll do bicep while we're up here. Find the tendon here. Good. And we'll go to the most common one here, which is patellar. And we'll test the knees. Good. And we'll go ahead and move down to the Achilles. Just going to have you pick your foot up for me. Go behind the ankle here. Good. I can feel the muscle jerk there. And just because I think I might have missed my shot here with the knees, we're just going to go again. Good. Good. Deep tendon reflexes are all intact. Next we will move to Babinski reflex. I'm going to have you lay down. And just pick up one foot here for me. And Babinski reflex is negative, which we would expect in an adult, whereas it would be positive in an infant. And then we're going to do the same sharp versus dull sensation like we did with the face, but we will do it in the extremities this time, so I'll let you feel it again. This is soft or dull, and this is sharp. Go ahead and close your eyes. Dull,
Sharp, sharp, dull, sharp, dull, dull, sharp.
Good. And you got all of those correct. So your sensation in the extremities is normal. And lastly, we are going to assess gait for any unsteadiness or instability. I'm going to have you stand up. And I'm going to have you do your best to walk in a straight line and go heel to toe. And heel to toe again. Good. Gait was very steady and stable. No instability there. And that is going to complete our neurological assessment. Everything was normal in a healthy young adult like yourself, but that might not be the case in sick or older adults as well. I want to thank you very much for participating in my video here today.
Thank you.
And that completes our assessment.